Assalamu alaikum and welcome to our channel Stars with HK. I'm Humayun Kamran, and in this segment, we spotlight various organizations and professionals dedicated to supporting differently abled individuals. In today's session, we have the pleasure to meet our special guest, Mr. Bahij Khouzami, who's the founder of Autism Intervention Specialists-Dubai. Thank you very much, Bahij, for joining us, and welcome to our channel.
Thank you, Humayun, for the invite, and it's a pleasure for me to be here.
All right. So I have given deliberately a very short introduction about yourself. So I would like to request you to share briefly about yourself, your education background and experience and expertise, so that it will be good for the viewers to connect and for us to build the session as well.
Absolutely. So my name is Bahij Khouzami. I'm a board-certified behavior analyst. I'm a licensed behavior analyst in the state of Massachusetts, and I am an international behavior analyst and a professional advisory board member for the International Behavior Analysis Organization, known as the IBAO, for UAE and Azerbaijan. I did my master's in education, specializing in autism and applied behavior analysis. With a specialization in autism from Cambridge College in Boston. I worked there for a few years before I decided to come to Dubai. I worked a year as a clinical director in one of the centers here. And then I decided that there's a gap in the service, the quality of the service. So I decided to have my own practice, to run things the way how I felt is ethical and can be like the way that we used to do things in the States. So I opened up Autism Intervention Specialists, and we have been operating since then, serving families in homes, in schools, in nurseries, in the community, and in our clinic.
So is there any place where AIS is located as well? And since how long it's been operated?
Sure. So we have been operating since September 2021. And we are located in Dubai, in Jumeirah Lake Towers. And the building name is HDS Center. And we are on the 21st floor, office or unit 2107.
Okay. So if I can ask, what services are you offering? Because you have a quite strong educational background and expertise in ABA. So what services particularly is Autism Intervention Specialists are offering to their clients or kids?
Great. Thank you for that question. It's an important question because our name, even though our name is Autism Intervention Specialists, however, the science of applied behavior analysis can be applied to any case, any person, no matter what the diagnosis is, whether it's autism, ADHD, OCD, depression, anxiety, some behavioral problems, Down syndrome, Fragile X syndrome, any behavior problem, any behavior disorder, anything you want to change from childhood, the infant until adulthood, we take care of that. However, our specialty, or most of our families that come to us, they are either on the autism spectrum, or they have ADHD or related disabilities, let's say.
So when people come to you, so they might have the proper diagnosis or assessment as well prior to coming to you, but there might be other. So can I ask, are you providing diagnostic services as well, or you then refer to some authorized professional for that purpose?
Sure. So just to add on the previous question, which I didn't mention, is that we also have psychology. So
Okay.
we have a psychologist that she does the ADHD assessments. She does all the educational assessments required from a school. Usually schools, they request a full comprehensive educational assessment, which our psychologist she does, and we take care of the behavioral problems for other students and children as well.
Okay.
And going back to
Yeah,
so going
please.
back to your question, so going back to your question is that we do serve these children, most of them in the schools, and they come to us in the clinic as well. Yeah, and if you can remind me again the question.
Yeah, that's the question. You have already answered that.
Okay.
Next, I would like to ask how many children you are being serving currently, if I can ask that.
Okay, so that information, unfortunately, I cannot disclose, but I can tell you that our capacity is limited to between 15 to 20 kids, and that is on purpose because once you have a higher number of kids and you have few clinicians supervising the whole case, it will affect quality. Unless you can keep the quality high, then you can have higher number of children within the 50, 60s, 70s, 80, 100 kids. But you need to have a strong clinical team that can handle that big number of students.
Right, very right. You have mentioned in the start that you are serving children at home or in school settings as well. So I would like to have some more information about how you operate, because serving in schools environment is totally different serving in the home environment. So I would like to ask how you operate. It's a one-to-one session, how you operate, or what is the detail of the operational mode of your center, or what is your approach?
Sure. So we do offer one-on-one sessions when it's needed and when it's advised by myself, which I am the clinical director. So it's based on case by case. However, we do also group sessions, and if our services are needed in the school, then we do it in a group session. If it warrants one-on-one, then we pull out the kid and we work with the kid in the school as one-on-one, and then we integrate them back into the class and we work with them in a group setting. If it's in the clinic, depending also on the number of hours taken, the time that we can do things, and what the kid needs, so that we can improve his quality of life. Is it one-on-one? Is it in a group setting? So it's case by case. Not everybody needs a group setting. Not everybody needs one-on-one. So that is based on the clinical judgment of the case and the information that we gather within our intake form.
Okay. And what about, do you believe in online counseling and online sessions as well? If yes, do you provide online services as well?
Yeah. So that's also another good question. There's a quite big number of research that shows that telehealth in ABA and autism field specifically, it does have a great impact and similar impact to providing this type of service. However, it does also warrant case by case. There is like an assessment to be done. If the kid passes that assessment, then they would be qualified for the online and telehealth services. If they don't qualify for that, then we will not do online sessions. And yes, I do have sessions with online. We have online consultations. We have online parent trainings. We don't have much of online therapy per se, like direct therapy, because most of our clients are located in Dubai, so they can come to us, we can go to them. What I do online is I do parent training online internationally.
Okay.
So I don't have therapists in different countries. I do work with the parents directly in other countries.
Okay. And if I can ask another thing about your center, if you want to share any unique feature that you feel that making some difference from others or other centers or facilities, if you can share that with us.
Sure. Well, the feature that that really makes the difference is whoever is supervising or managing that place, because you know, I don't know if you guys have that saying, but we say that leave the bread to the baker. So
Okay,
so
yeah.
so if you are not in this field, or for example, you have clinicians who are not in the autism field, and they start giving treatments and therapies and stuff like that without any evidence, without knowing what to do. So, and most centers, if it's not owned and operated by a board certified behavior analyst, then you might have some quality issues. So what I would say from my side is the integrity first, the trust, um, whoever is running that program or whoever is the supervisor, that plays a big role in the improvement of the treatment, because you can have the best treatment plan, but if you don't have follow up, you don't reevaluate um, on a weekly basis, if not daily. If you don't have the integrity of doing things properly and supervising and training your staff, then that plan will fail for sure, no matter how good it was. No matter
Mm,
how good you write that plan as a supervisor, it will fail if you don't have the right people to implement it. If you're just gonna write it and then leave it and say, okay, well, I gave you a plan, go do it. That doesn't work like that.
okay, fine. Very right. We have heard about yourself, your experience and expertise, and you have mentioned about your team, a part of your team that is psychologists. What other team members you have in your staff?
Sure. So we have several behavior therapists who are either studying or they already took the exam and qualification for the behavior therapist certification, which is the International Behavior Therapist, and the abbreviation is IBT. And that comes from the board in the States, which is the IBAO, that I am a professional advisory board member for. So anything that happens in UAE regarding these candidates, whether they are studying for their behavior therapist position or they are studying to become supervisors like myself, I am responsible for these kind of things that happen in UAE. So all of them are being trained on the 40 hours to meet that requirement. And then there is always constant clinical meeting and trainings that goes on. Because if my staff cannot improve, then the kid will not improve. If the
Exactly.
staff does not get the proper training beyond of what they know, then that kid will not go beyond what they know as well.
Mm, mm, mm. Okay. Next, one common questions that you might encounter on a daily basis: how expensive the services from AIS can be for the parents and caregivers, because we have heard that therapies or related services in the Middle East are quite expensive as well. So what's your take on that?
Yes. So, unfortunately, this is a topic that is very sensitive to most of the parents. We do understand that. It is a quite expensive therapy because it's a specialized kind of therapy. It's not easy to find a BCBA or an IBA, a supervisor, and especially a good one. So that comes with some expenses as well as a good therapist as well. So just like any other profession where a doctor can have a consultation with thousands of dollars and another one will have it for a few hundred of dollars. Same thing. So, it's the quality and the value that and the experience that the clinician or the center will bring in. And in the States, the insurance is covering all this,
Mm,
which
mm,
is good. That's why we see a lot of centers, and that idea that this business is lucrative is because of that. So
mm.
they will get families, they will charge the insurance, and then the insurance will pay them.
Right.
Unfortunately, that model is not quite heavy in most of the countries except USA.
Mm,
Hopefully, something will be done to have the insurance cover it. But yes, I do hear the parents who are saying or complaining about the high cost of this service. But keep in mind that we spend years in study, years in education, years in experience to become supervisors, and
Right.
our continuous education as well. So once we graduate, it doesn't finish there. We still have to renew our license and and certification every 2 years and attend conferences just like doctors they do. So doctors as well, they have to keep their medical license. We do as well. They have to attend conferences and earn points. We call them CEUs, continuing educational
Education.
units.
Right.
We do as well. So that comes with a cost. So the knowledge and the experience and the appropriate diagnosis and the appropriate treatment plans that we give is not just coming from easily just reading a textbook.
Right. Okay. One more thing that in our part of the world, parents are quite demanding the sessions observation. They are a high demand that parents want to attend the session, to observe the session so that they can see how professional is working, so that it can help them to help progress their child. So what's your take on that?
Sure. So if you ask me that question a year ago, I would have said absolutely parents, they should attend sessions. However, I will adjust my answer to saying it's case by case. And the reason why is because some parents, their presence establishes the triggers for some behaviors for the child. What we do is we advise such parents to not attend the sessions until we have these behaviors under control. Then we invite the parents to come into the session. It is in our policy that every session you have in the clinic that you have to be present so that you can learn. Now, if you want to stay, you're more than welcome. We encourage you to stay. If you don't want to stay, then that's up to you. But we have it in our policy. We do encourage it. I do tell to the parents about that, and I leave the decision up to them.
And what about training and guidance, counseling to parents? Because that is one thing they need as well. So do you provide some sort of training as well to parents, how to deal with the particular challenges of their child?
Absolutely. So when they take the service from my center, everything is included. It's an all-inclusive package that they get. I have seen other centers where they will charge these things separately. So they would charge the session separately, the parent training separately, even meeting with the supervisor in a separately, the supervision, the continuous supervision for the sessions from the supervisor is charged separately. I don't have that model. I have an all-inclusive model. So whenever they take the service from me, then I also give them the parent training without extra charge. I give my supervision without extra charge. All these things, they are come within the package that they take.
Okay. And one of the last questions is what you think about the current rehab field as a whole. What you think if we want to take it further, improvement in a positive direction. So what things we need to focus, or what deficiencies you feel in this rehab field as an overview, if you can shed some light on that as well.
Sure. So I would like to comment on the word rehab, if I may, because rehabilitation means that a person has lost something and now we're trying to get it back. In some children with autism, they didn't lose that skill. They already were born with that skill deficit. But when the kid is 1 year, 2 years old, and they used to speak or they used to do some skill and they lost it, now we can use the word rehabilitation. So the word of rehabilitation, how it's being used, like if you go to the States or if you hear news about the States, you will very little read or hear the word rehabilitation in the autism field because of that reason, because it's not seen that as a skill lost and now we're trying to get it back.
Right.
But as I said, and as I explained, it does apply when a kid had the skill and now he lost it. Now we can talk about rehabilitation. So that was just a little bit of clarification for your audience.
Right.
Because we have been seeing it here a lot. I have been seeing it here a lot in UAE and Middle East, and I would just like to use any platform to correct that.
Right. Thank you very much for that.
Understanding.
Yeah.
Thank you. So the question I believe you were asking is about how we can improve.
Yeah, this field.
In my opinion, the only way to improve this field is through setting like a committee or like a board of guidelines. So in the States, they have that. They already have these things. You have like an accreditation body where they would come in, they will evaluate your center, they would evaluate your services, they will give you a certificate to, if you passed, that you did meet the requirements of the ABA services. They do have from the state, each state has their own autism treatment plans and guidelines and rules and all these things, which that don't exist outside the United States, at least not yet. So hopefully that work is being done or will be done outside the United States, so that can have that thing. So here in Dubai, they do have that from DHA, which is the Dubai Health Authority. They issued these guidelines a couple of years ago, but I'm not sure how much it is enforced and so on.
The same problem here in Pakistan as well, but we are also working on the formation of some sort of board so that there can be some check and balance as well in this field as well. So one last question, and before we conclude this session, what is your advice for parents and caregivers when they're looking for or selecting any center or professional for their child? What points they should focus, how they can select a good profession or a good center?
That's an excellent question, because so many would tell you get a reputable center. However, I have seen a lot of reputable centers and parents going there, paying a lot of money, staying there many years, and then they end up being dissatisfied for one reason or another. So I wouldn't advise to check for a reputable center or not. I would say do your research.
Okay, yeah.
Do your research. Ask around. Ask about the center. Ask about the supervisor. Ask who's there, how long that person has been there. If the center keeps changing supervisors, that's a problem. That's a problem. If the center keeps changing therapists, which it does in our field, unfortunately, the rate of turnover in the field of autism is very high. In the States, it's almost 80%. Turnover in RBTs, because it's challenging to work with this population, and the consistency and the pay and all these things. So when parents don't pay you as a center, who's going to pay the therapist then? If parents don't want to pay for the service, how are we going to pay for the therapist and the expenses of the clinic and the center and the operations? So that comes back to the insurance covering and all these other financial requirements that we discussed earlier. But I would say ask, do your research. Don't just say, I heard that the center is good. Just do your research. Who's there? What's their name? From where they were? What are their qualifications? Not everybody is qualified to work with autism. Like the other day, I saw a doctor, an eye doctor, talking about autism and screens. And when he was talking, he was not talking about the impact of screens on the eyes of the kids with autism. He wasn't talking about that. That's not your field. You know, stick to the eyes of kids and children who might be affected from screens. But it's not for you to say that screens causes autism. That's not your role. You don't know any better. Same thing goes for pediatricians and neurologists and psychologists and psychiatrists. You need specialized training in autism to be able to diagnose, to be able to give a treatment plan. So in the States, how it goes is The family goes to a psychologist, a neurologist, or a psychiatrist. They will get the diagnosis from the doctor. The doctor will say, autism spectrum disorder. What is the treatment? What's the prescription? Applied behavior analysis. You take that paper and you go to centers like mine to get the treatment. The doctor himself will not tell you, come to me, I'll give you the treatment, which we are seeing here. So they do say, we will give you the treatment plan as psychologists, or maybe they do know. I'm not saying no, but do your research. Do they have experience and qualification related to autism other than their general education, like a pediatrician or so? But again, the science and the research has proven that applied behavior analysis is the golden standard for treatment of autism. Right.
Okay, with this excellent advice and tips, we are at the end of our interview session. I would like to thank you, Bahij, once again for your time and support. And I hope this information from your end would help people who are seeking such services in Dubai and around. So thank you very much once again.
I hope that information helps as well. And thank you for having me once again. Thank you.
And thank you as well for watching this video, all of you, and hope to see you in our next session with a new guest or topic. Until then, take care and Allah Hafiz.